So welcome back, everyone. I'm really thrilled for those of you who are tuning in again. Thank you for again checking in for another Joint School session. And for those of you who maybe it might be the first time you're watching one of these videos, we have a special treat for you today, because we will be joined all the way from Melbourne, Australia, by Mr. Tony Dunin, who is a very experienced reconstructive orthopaedic surgeon. But he also has the really rare skill set of also being a trained mindfulness and meditation teacher. Now, I first came across Mr. Tony Dunin in Dr. David Love's excellent Life in Medicine podcast. And it was something I listened to while out jogging during the real peak of the pandemic here in London. And it really resonated and stayed with me. His thoughts and ideas and experience around the benefits of mindfulness and meditation, which is something that I'm sure we're all seeing is becoming really sort of part of the mainstream. So I'm really intrigued and excited to hear more about how mindfulness and meditation can fit in with orthopedics, and particularly how it might benefit people who are getting ready for hip and knee replacement surgery, and also in the early and further stages of recovery from these operations. So thank you very much, Mr. Dunin. Thank you for joining us.
Hi, Axel. Thank you very much for inviting me.
No, it's a real pleasure, a real pleasure that you're tuning in, and I think I'm really hopeful that this will add quite an interesting angle in terms of the support and especially in light of the strange circumstances that we are in because of COVID-19. But before we start, is there anything you'd like to add to your introduction in terms of who you are and your experience?
No, I've been involved in orthopedics for a long time, and my areas of interest have been mainly hip and knee replacement. I spent some time in your country, in the UK, in Brighton, years ago. And then following that, I had the great opportunity of working with Professor Emile Tournelle in Paris, who was the doyen of fractures of the pelvis and acetabulum. And from that, I developed a really strong interest in the hip and continued to be involved in the frontiers of hip replacement and reconstructive surgery.
Excellent.
As well as that, I do knee replacements too.
Yeah, okay, fantastic. And so when and how did you encounter mindfulness and meditation?
I think I always had a bit of an interest in the Eastern arts, and I did yoga for a while. And from doing yoga, most of it is doing the practices of movement exercises. Mm-hmm. But at the end, you always finish up with a lying down meditation. And I felt that was something I wished to explore further, but there was insufficient time in a yoga class to really do that. So I explored what was available on the internet and found this fellow, Dr. John Kabat-Zinn, who was a molecular biologist who had developed the mindfulness-based stress reduction course back in 1979, a bit of a mouthful. But he was a scientist by nature, but had studied the Eastern philosophical traditions, particularly Zen and Buddhism, and decided to take what he had learned from those traditions back into Western medicine in the United States. And he set up this semi-structured, semi-experiential course over 8 weeks. And so I decided to explore that further. At that stage, I had some leadership positions within our association and been very busy with my work, and would be regarded externally as being quite successful. But internally, there was a fair bit of stress. And I was looking at ways of dealing with that stress. And so I did this course quite some years ago. And for me, it was a real game changer. It changed me from someone who was existing, coping okay, but now to someone who was flourishing, becoming much more interested in work. Everything became much more exciting. And rather than being seen as a retreat or withdrawal from life, it was really engaging with life full on. And fortunately, I was supported by my wife, Jo, who did that course with me way back in, a long time ago now. And then following that, both of us had the opportunity of being involved in a trial at our hospital at St Vincent's in Melbourne.
Oh.
It's an academic tertiary hospital. We've got an excellent psychiatric department, and the orthopaedic and the psychiatric department got together to run a trial looking at the benefits of mindfulness prior to joint replacement surgery. And we were both facilitators in running those courses. Now, in doing so, we had to go from both being a student of mindfulness to becoming a teacher. So it was quite rigorous training we did over a few years, and then we're involved in the study, which took quite a while to publish because it was a hard job to get it done, because you had to recruit people who had no knowledge or interest in meditation and mindfulness. So it was hard to capture sufficient numbers to get a meaningful response, but eventually we did. And the results were really very promising. And so for your listeners here who are patients waiting for surgery, they may be interested in hearing some of these results, because what we found was we had 65 patients. It was a randomized trial. So you have one group who were the active group, who had the meditation course for 8 weeks prior to their surgery, and another group who were the control group, who had their elective surgery as planned, treatment as usual, as we call it. And in the 65 patients who had the active treatment, the results after 12 months following their surgery were better from the point of view of pain and function than the control group. So that was interesting. The other interesting thing was, which may be applicable today with COVID-19, where people are waiting a long time for surgery, is that 20 of our patients in the treatment group pulled out from having their joint replacement done for a number of reasons, but 14 of that 20 pulled out because their symptoms were much more tolerable after doing the mindfulness course. So they felt, they still had pain, still had some disability, but they could cope with it. Now, not to say that they later on didn't have joint replacement surgery, but that was incredibly powerful statement that they felt life was quite tolerable as they were without needing a major operation.
And that's fascinating. I think that touches on quite a few themes that we've uncovered over the course of these videos over the past few weeks. That there is so much more to pain relief than medication, and also indeed, as I spoke with Dr. David Love the other day, and he was talking about the value of having more than just one appointment, perhaps when planning an operation, or really thinking about it, and from the patient's point of view, being able to set expectations and really form a clear idea of what's in store, what can I do personally, what kind of agency will I have over my situation, and the kind of really the sort of the many different aspects that add up to one's quality of life and one's relationship with chronic pain in a joint, and the timing of when surgical intervention is required. It's really fascinating to hear that. And in that study, so it's interesting that the effect was measurable at 1 year on from the operation. Did you have a handle on how had that group made mindfulness and meditation a part of their day-to-day? How sort of, to use a sort of physiotherapy term, how compliant were they with the protocol, so to speak? Did that vary? Was there a sort of dose impact relationship, or was it more that they'd had that input around the time of surgery and during the recovery?
You bring up a couple of good points. What we do know is that they attended the 8-week course. How much time they practiced, both during the 8 weeks, because we gave them homework. So each day we asked them to do some guided meditation. So we gave them through the course, and technology changed, because initially it was a big CD we got them to play, and some of them didn't know how to work a CD player. So we gave them these were public patients, and some of them were not familiar with sophisticated technology. So they struggled a bit with that, because a lot of them were older patients, but we gave them CD player and other things. More recently, of course, we can give them the guided meditations either online or on a USB or via Dropbox, so it's become a little bit easier. But we did ask them to do some homework because we believe that is important as far as the dose go. But we really can't say how much they did during the course or afterwards. We're also well aware that because they came as a group, we knew that that would have a positive therapeutic effect, that it may only last a short time. So when we looked at the results at 3 months, they were positive. We expected that just from the group effect.
Yeah.
But at a year, we thought the group effect would have worn off because they were no longer in contact with each other.
Yeah. Interesting. And I mean, I'm quite new to the concept of mindfulness and meditation as well. It's certainly something I've been exploring more in recent weeks, and very much in part triggered by the conversation that you had with David Love on the Life and Medicine podcast. And I imagine, as with many things, it would be very much a personal thing about how you incorporate it into your day-to-day. But so if we go back to how you use mindfulness and meditation in your daily life and in your practice as an orthopedic surgeon now, sort of how is there a routine that you follow? Is there a certain time of day? Tell us a bit about your interpretation and application of it.
Sure. Well, some of us are different, and some of us will find a better time to meditate. And it's something that you can't just squeeze into your life. You have to make it part of your life. For a lot of people, the best time's early in the morning. There are no distractions. You can get up when the other people aren't around. But I find personally, the end of the day is a good time, and also at lunchtime. I make time. Usually I'm operating in the morning and I'll be consulting in the afternoon. In that transition period, it'll be when I will do what I call formal mindful meditation practice. So that's one component. But there's not much point having a practice where you're sitting down, meditating, and not taking it into everyday life. So with regular practice, I then start to take what I do into my work, both in consultations as well as in the operating theatre, which might be a surprise to many of those who are patients. But in fact, it makes me, I think, a better doctor and a better technician. I'll give you an example. Normally, when we start an operating list, and you would experience this, start the list, you wash your hands. Usually, most of us were already in the operating theatre. Our mind is. Not our body, but our mind, as we're washing our hands. We've got no idea what we're doing with our hands. We're in automatic mode. Okay, so when I'm washing my hands, I am washing my hands mindfully. I'm aware of the water touching my hands. And the initial scrub, because it's automatic, these days, it's cold. Oh yeah, cold, unpleasant. But leaving the hands there, with time it starts to warm up. Oh, it's becoming pleasant or neutral, and then really pleasant. Putting the soap on my hands, feeling what that feels like. And that can be quite soothing, very relaxing before you operate. So being in my body, being in the present moment, okay, is what it's about. So that puts me in a good psychological state to go into the operating theatre. Not so revved up, not so much into planning, thinking about the future. When I'm in the operating theatre, I'm also at times, we're usually as surgeons, we're focused. And it's a little different from being mindful, because when you're focused, you're concentrating on one thing, which is good. When you are really mindful, you're aware that you're aware. So that's another step further. And when things are difficult or when things happen unexpectedly, your ability to be able to retrieve the situation, I believe, is far better if you've got a mindful practice, which I found really helpful.
Yeah, fascinating. I mean, there's something that I recall from operating, and indeed something one of the main things I miss about operating is that flow state of like being in focus, kind of going through steps that you've done before, but slightly different this time. And so you're very much, I mean, in many ways that in itself is a mindful mindful experience of having absolute focus at the task at hand. But would you consider that mindfulness and meditation? I know some people equate the kind of flow state of work with mindfulness and meditation, but does that ring true for you, or not quite?
It's similar, but it's got another level to it. So if you look at what happens to your mind, and if you look at the pathways or the parts of the brain that are lighting up, they're different to what happens when we're in what we call self-referential thought. When we're daydreaming, when we're thinking about the future, that occurs in parts of the brain which are towards the midline, called the default mode network. And there's one part of the brain that's called don't want to make things too technical, called the posterior cingulate cortex. And when we see that light up, we're daydreaming or we're doing that. When we're in task-oriented mode, or when we're meditating, the parts of the brain that light up are quite different. The insular and more to the front of the brain. So they're similar, but as I mentioned, that when we're being mindful, we're also aware of what's actually happening in our mind. So we're aware that we're aware.
Yeah. Interesting. And over the years of then incorporating mindfulness and meditation into your daily life and your daily work as a surgeon, has it changed or shaped the conversation that you have with your patients in any way?
Very much so. I used to find consultations sometimes a little bit of a chore, that there would be a degree of anxiety about how things would go. One would get, particularly if you got behind in time, and I'm a person who likes to be punctual. And so you'd be thinking the whole time, how can I get this consultation finished quickly, but at the same time giving the patient reasonable service so that I can catch up. So your mind would be about how to hurry. And what we know is if you do that, a patient becomes aware that you're in a hurry too. So now I'm able to let that go. And so I am very much present for the patient. And not just simply as another person who has an arthritic hip or knee, but it's a unique human being who's walked in the door. So I make a moment to pause before the consultation starts, to move into what I call a transition, to be in this moment for that patient. And I found that it is extremely helpful for the consultation to obtain the information, and the patient is aware that I'm present for them. So they're more likely to know that I'm interested in this human being. They're more likely to comply with what I ask of them.
And I guess, and have you found that takes longer? Are you spending more time with patients now, or is it sort of a...
Surprisingly not.
Interesting.
There are some patients you will, and I will let that happen. But there are other patients where it doesn't seem to take a lot longer. We know that in the past, doctors tended to interrupt patients after 17 seconds. And what will happen is the patient will feel frustrated that they haven't been heard. So they will actually go over the story several times, which will in fact take longer than if you've sat down, listened, be quiet, let the patient tell their story, how they want to tell their story.
Interesting, very interesting. And more broadly about how, what are your thoughts around how mindfulness and meditation might help someone who is now getting ready for a hip or a knee replacement procedure, or indeed may even be in the stages of recovery from these operations?
What we know from our study is that the patients who did the course beforehand, many of them commented how it changed their relationship to pain. Their requirements for narcotic analgesics, which some of them are on, lessened or dropped away completely. But also that pain was not didn't cause as much suffering. They were able to deal with it much more easily. Their relationship to that unpleasant sensation dissipated. So it was tolerable. Whereas the opposite can happen in that if you're waiting for surgery and you're not sure when it's going to happen, often our brain will say, this pain is killing me. This is intolerable. Why should I have to put up with this dreadful pain?
Mm.
So these stories, what they do is that you've got the pain because the joint's worn out. But those stories in our head amplify the pain and make it much, much worse. Yeah. So if we can change that so that we catch ourselves saying, well, that's not particularly helpful thought, and it is only a thought, it's not necessarily factual, then it can change my relationship to the pain. The other thing is that sometimes we'll get concerned about, oh, this surgery is going to be painful, this surgery may go wrong, I might still have the pain afterwards, or if I've had the surgery, it may be painful afterwards. Oh my God, this pain is never going to go away. I shouldn't have had the operation. Catching those thoughts and saying, well, my doctor's told me it's expected that you'll have some pain for a while, but it's temporary, it'll pass. So you become an active agent in your own recovery by being mindful. That you're part of the healing process. It's not you're there as a purely passive being and letting others operate on you. You're an active agent in helping yourself recover. And we know that. The patients who have a more positive attitude towards the procedure will generally do better.
Yeah, fascinating. And so for those out there who are watching this and thinking, wow, well, this this sounds like something I could potentially benefit from. What should they do next, so to speak? I know that you are teaching a course at the Melbourne Centre for Mindfulness, which is also available virtually. And of course, we will make sure there are links to the Melbourne Centre for Mindfulness below this video. But what are the steps that one should take to explore this?
Sure. We've been very lucky that there's been an explosion of these courses called MBSR, Mindfulness-Based Stress Reduction, throughout the world, thanks to John. Now, you might say, well, it sounds a bit soft and fluffy. What's the evidence? And John, as a scientist, knew it wouldn't last unless it was subjected to a lot of scientific scrutiny. And there have been many studies demonstrating its effectiveness, both for certain conditions as well as human flourishing. And we're the first to really do it in surgery. So we're not teaching something that doesn't have good background evidence that it works. As far as its availability, it's available throughout the world physically, but at the moment, pretty well most of us who teach MBSR are doing it online. And obviously you want to do it in an area that may be in the time zone that suits you. There's also been many online programs by John Kabat-Zinn, if you look him up, and you'll find John talking about mindfulness, and that's a really good introduction. He speaks so well about what it is and the benefits of it is a start.
Excellent.
The MBSR course does require time and patience and a bit of work from those involved. And John set it up as an 8-week course because he knew it took that amount of time to create a habit. Now, there are cheaper and simpler and shorter alternatives, but are they subjected to scientific scrutiny? No. So I'll come to one thing that's really helpful, and that is apps. People will often go to apps first, and there's quite a few, Smiling Mind and various others. But the problem with them is that people try them for a little while, then they give them up. They haven't got the motivation to continue. And one of the problems is they are not involved with a teacher. They're not involved in a group with other people who they can say, oh my God, this person is experiencing the same thing I'm experiencing. I thought I was the only one who had these silly, ridiculous thoughts. Okay, so that's one thing that I would say. If you can find the course wherever you are, that's a far better end result than it would be from doing an app.
Okay, interesting. Because I was going to ask actually. Do you know if there is there a measurable difference in the impact that mindfulness and meditation has from doing it, as a group, or from sort of doing it sort of in a self-learning mode? so to speak.
There is, in the sense that Nicholas Van Dam, who was an academic at University of Melbourne, in my own city, he has done some work on looking at apps, and so far they haven't come out too well.
Okay, interesting. And you're looking more specifically at meditation and mindfulness in surgery and orthopedic surgery. What are the sort of the more recent results that, or indeed what are the projects that you're currently looking at in that? What's on the horizon?
We don't have any recent research, but just to touch on a couple of things, is that when we did our course at St Vincent's Hospital, a lot of the staff heard about it and said, these patients seem to be doing pretty well. We're pretty stressed out too. Can we have a bit? And so Joe and I started teaching staff the same course, and we got big numbers. And then the hospital said, well, we're not too sure whether we should support you doing this. Have you got any evidence? So we did a monkey survey, sent out, and to our great surprise, the results were overwhelmingly positive in their professional and personal life. So that was from just what we did. Now, not subjected to scientific scrutiny, but a huge number of the staff who had attended the courses gave us incredibly positive feedback. From that, we were approached by our medical association, the AMA, because they had a lot of stressed out doctors. And then we started specifically teaching doctors. And Joe and I did a course from Rochester, University of Rochester, up in New York, taught by a few people who have been the world leaders in teaching mindfulness for doctors. And Ron Epstein, Mick Krasner is another one. And they've written quite a bit about it. And they've done some studies demonstrating the effectiveness for primary care physicians in improving their empathy, their burnout rate, and various other positive factors to make it worthwhile for doctors to do it.
Yeah. Interesting. And I guess, so as with anything that has the potential for really significant impact, there are, it must be treated with respect, and I also as particularly when something comes into the mainstream, as I feel mindfulness and meditation has increasingly in recent years, there will be cases of the benefits being overstated or things not quite applied in the right way. Like, are there any cautions and risks around meditation and mindfulness that
there are
that you would flag?
So before any person joins one of our courses, we do an interview. And we ask them to provide a bit of medical background. And we have got some criteria we would say you may be better off doing a different form of course. We're not psychologists, counsellors, or a psychiatrist. There are some patients who may be better having therapy or having care under their general practitioner or psychiatrist first. That's not to say that if you've had a history of depression and it's stable, perfectly okay to do the course. But there are certain conditions where it may not be so applicable. Particularly if you've got a psychiatric condition which is unstable, then we could certainly potentially make things worse. And we've got people who teach other mindfulness-based courses which are more applicable for people who have got a history of a more acute depression or of other conditions as well. And generally, we will not take on someone who's had a psychosis, because that could also cause potential harm to them as well. The other area that potentially could, you'd think, maybe cause harm, because you're getting in charge, you're in the present moment, is PTSD, post-traumatic stress disorder. But in fact, there's pretty good evidence that PTSD can do quite well with mindfulness.
Okay, interesting. Very interesting. And I guess, there's as with anything that has a strong potential, it must be treated with respect. So that's interesting as well. And in terms of then the next steps, where do you think, where do you see the relationship going, or how mindfulness and meditation is is used in orthopedic surgery and perhaps even beyond?
I would like it to see it to become more part of the mainstream of dealing with pain.
Yeah.
We know what's happened when we've gone the other direction, which is to treat people with kindness by giving them lots of opioids.
Yeah.
We kill them,
Mm.
or we make them drug addicted. And now we're trying to get them away from all these drugs. And it's very, very difficult.
Yeah.
So I think it will be a slow burn. It'll gradually happen, but it's going to happen slowly for a number of reasons. One is that surgeons and other doctors are naturally skeptical about things that they're not familiar with. It's not something they were taught as in medical school, even though it's been shown time and time over that it can be incredibly beneficial. The other thing is that it's not related to a lot of money. So if you're wanting to do a trial on a drug, then the companies supporting the drugs are only too happy to assist you in doing randomized controlled trials. But unfortunately, that doesn't happen with mindfulness.
No, no, there's not much needed really. Although, as you've touched on, the ideal environment is a supported environment, and perhaps with a group and a trained practitioner.
That's correct. Yeah.
So there will be some costs associated with that, but certainly not too much.
For those who teach MBSR and similar courses, you don't do it to make a lot of money, because there's not a lot of money in it. We do it because we realize its strength, its power, and its benefit. And so we come from an ethical background that we're wanting others to get the benefit that we've got from it, because we realize that it's so powerful. As an orthopaedic surgeon, I've been incredibly grateful for the life I've had, the power and ability that I have to help a person with joint replacement surgery is amazing. So many of the patients come back and say, "Doctor, you've changed my life. You know, I feel like a new person because of the joint replacement." They're saying the same with MBSR. You know, if I'd only known about this so many years ago, you know, this has changed my life. So here I am teaching two thoughts. One is treating one thing with one tool I have, and with another tool, which is mindfulness, I'm helping people in another way. So I'm very grateful.
Yeah, fascinating. I think that's a really really inspiring and positive note, really, to sum up our conversation. Is before we sign off for today, is there anything else that you would like to add or say?
I don't think so, but hopefully you can see, for someone who's got a lot of white hair, I still have a lot of vitality about myself, and that's because of mindfulness.
Yeah.
And you know, if you want to be happy, then it's a good way to be. And the other thing is, you become a person who's willing to give to others because of the mindful practice. It does come with some ethical background to it. So as the weeks of the course go by, you learn to be kind to yourself, to be gentle with yourself. And in doing so, you then can show care and compassion to others.
Yeah.
And I think that's one thing that can really come out of this course. But it's a slow burn. It takes time.
Yeah.
There won't be any dramatic change. It's not something where on week 2 you're going to be blissed out. You might be the other way for a little while before you realize the benefits of doing such a course as mindfulness.
Oh, fascinating! Really, really, really interesting to hear, and I'm sure many people will find this this conversation an interesting addition, perhaps to what they're already thinking and doing, maybe. And for those perhaps who have been less familiar with it, maybe this will serve as an introduction and a first step towards taking a bit of time to be gentle and kind to oneself and others. And I think that's a really wonderful message for this video and this interview. So thank you so much, Mr. Tony Dunin. This has been a real pleasure. To everyone out there, thank you too. As ever, we'll be back soon with another video. Please do comment below on what you thought about this video. Has it sparked any questions? Do let us know if there's any topics or anything that you'd like us to tackle in an upcoming video, and we'll surely get to it. And in the meantime, everyone, be safe, keep well, and keep up the good work. Take care out there. Bye bye now.